Hey guys, just want to say a quick thank you to everybody that reached out with a topic that they were interested in learning a little bit more about. I'm not sure what I'm going to call these yet. I was kind of considering I teach, but that just seems maybe a little bit smug for what these are going to be. The first topic today is going to be kids eye care and infant eye care in general. None of these are meant to be taken as specific medical advice. Obviously, every patient is different, every case is different. This is more so just general overview or general background so that you can make an informed decision in terms of the kids in your life. The two things I want to focus on with this topic is the why and the when, because I think those are the two most important questions to answer in regards to kids' eye exams and infants' eye exams. A couple of stats in terms of why kids' exams are important. The College of Optometrists and Vision Development reported that about 80% of learning during the first 12 years is vision related, so obviously really important. The Ontario Association of Optometry reported that 1/6 of kids have some kind of vision problem that's serious enough to affect learning. The American Optometry Association reported that 60% of students identified as problem learners have some type of underlying visual issue, either alone or as well. And then the Ontario Ministry of Health, now this is back in 2002, but they reported less than 25% of kids under the age of 10 have had an annual eye exam with optometrists. Those numbers have likely gone up now because the Canadian Association of Optometry and all the provincial associations have done a really good job educating the public and reaching out and letting them know that kids' eye exams are covered in most cases annually. In Saskatchewan, as long as you have a valid Sask health card, you are eligible for an annual eye exam up to the age of 18. What is our role in the whole eye exam experience? Our role is to treat things like eye turns, refractive errors. What that means is the prescription for the glasses, any type of binocular vision disorder, so how well the eyes work together. In some cases, myopia control, and what that is limiting the amount of nearsightedness that develops over time. As an eye care provider, it's not our job to predict what a child's potential is based on their visual development, but it is our job to intervene if there is some kind of problem so that we allow the child to reach whatever their potential is. So when should the exams take place? There are different guidelines depending on the legislative group, but I'm going to focus on the Canadian Association of Optometry because that lines up pretty much the exact same as the Saskatchewan Association. So their suggestion is the first eye exam take place between 6 and 9 months. The second eye exam take place between 2 and 5 years, and then annual examinations after that from age 6 to 18. So why do they suggest that timeline? A question I get all the time is like, what the heck are you going to do with an infant once they get in there? It's not so much to provide a complete eye exam. I mean, we try to as much as we can, but there's limitations in terms of what we can do. The biggest goal is to actually rule out congenital health issues and vision-threatening issues. So I mean, there's tons, but the big one is retinoblastoma. So that's a tumor of the eye that can actually be seen. Not a nice one. We don't run into those very often, and we don't like to, but it's something we have to rule out. Congenital cataract, so that's when you're born with a cataract, whether it's in one eye or both. Obviously that's going to cause a little bit of a detriment to the vision. It's something that needs to be dealt with if it can be. Another one would be like infantile esotropia. So what that is it's an eye turn in, either on one or both eyes. Again, something that we monitor or sometimes send to a specialist. And another one, I guess the one that we kind of focus on the most is really large refractive errors. So what that means is like a really big prescription. Think like +6 or -3 or something along those lines. We like babies to be around +2, that +3, depends on the practitioner, to 3 year range. What we're looking for there is eye turn, again, either in or out. Really high refractive errors, so same thing if we need to treat with glasses. And then the last thing would be like anisometropia. So what that is when one eye has a really high prescription compared to the others. So some kids are just using one eye, the brain starts to shut off the other one, and we don't know because that one eye is so good, they can point things out far away, but they have a hard time with things like depth perception, binocularity, that kind of thing. The other thing is that as they grow and as they come in, we do a lot more of a complete exam, which means we get kind of more pieces to the puzzle as time goes on. So again, at 2.5, a little bit more complete exam than what we would have done between 6 to 9 months. At those school age exams, so 4 or 5 up to about the age of 18 there, we spend a little bit more time focusing on binocular vision, so how well the eyes work together, and then also the smaller refractive errors that can still affect visual development and learning. Hopefully this serves as kind of a nice synopsis in terms of why and when we like to examine kids' eyes, right? If you have any questions for me, don't be afraid to reach out in the comments or direct message us. I'm always happy to talk eyes with just about anyone. Thanks.